So my name's Kath. I'm Nursing Services Lead for the charity. Joining me on the panel today, I also have Sharon McNaughton, one of our nurses.
Hello.
And Mary Beresford-Jones, also one of our nurses.
Hi.
We also have some support in the background from our marketing team. So thank you to you guys as well for helping us with the webinar today. Just some housekeeping points. So as you will have already seen, the webinar will be recorded today, and that's so that after this session we can share this on our website. Please be reassured that as your cameras and mics are turned off, you will remain anonymous throughout. And if you have any questions, please use the Q&A function to ask these. Just as a note, these questions that you ask are only visible to the panel, and there will be an option to ask those questions anonymously as well. There's a button that you can tick. The Q&A function should be along, it's on the bar on the Zoom functionality. And there'll be an opportunity for us to answer those questions midway through the webinar and then also at the end. We would also encourage you to use the chat function throughout. This chat function, just to be mindful, is visible to all attendees. And just to also make you aware that the chat transcript will be recorded internally, but it won't be available on the recording. So thank you. Without much further ado, I'm going to hand over to Mary, who will take us through the first part of the webinar. Thanks, Mary.
Hi. Okay. Welcome. So, did you know that on average, men are less healthy and have a shorter life expectancy than women? Part of the reason for this health gap is that men don't take care of themselves as well as women do. Men are more likely to engage in unhealthy behavior and less likely than women to adopt preventative health measures. They are in general more likely to work in dangerous occupations and often put off going to the GP. In fact, men may not need to see their GP routinely again after they've had their teenage vaccines, whereas women are used to going for certain health screening, pregnancy-related issues, childbirth, etc. As a result, men die younger and in greater numbers of heart disease, stroke, cancer, diabetes, and many more other diseases. In 1920, women outlived men by an average of 1 year. Today, that difference is more than 5 years. More than half premature deaths among men are preventable, but you can't prevent a problem if you don't know it exists. So Nick, can you share the first poll? There we go. So if you'd like us to answer yes or no, would you feel confident visiting your GP about specific men's health issues? Oh, okay. So yes, 67% of you feel confident about visiting your GP. So that's good. Fantastic. So today we're going to briefly touch on some parts of men's health. It might be relevant to you, it might be relevant to your son, dad, brother, uncle, friend, or a colleague. Prostate cancer. The normal prostate is a small, squishy gland about the size of a walnut. It sits under the bladder and in front of the rectum. The urethra, the narrow tube that runs the length of the penis and carries both urine and semen out of the body, that runs directly through the prostate. So due to this position, if the prostate swells for some reason, then urine flow can be affected. So if you are dribbling when you pass water, or you can't get the wee to flow, or you can't get to the loo quick enough to pee, then see your GP. Penile cancer. If you have any lumps, growths, ulcers on or around your penis, then see your GP. Male breast cancer. If you feel any lumps around your breast area or any changes in appearance of the breast or skin, then see your GP. We will now go into a little more detail about testicular cancer. So during today's webinar, this is what we hope to recover: about your testes and what they're for, the symptoms, what to look for and how, and what else could a lump be. Testicular cancer occurs when normal healthy cells, which are carefully regulated by the body, begin to reproduce uncontrollably within an area of the body, such as the testicles. And you can see on the slide here, every year over 2,400 men will be diagnosed with testicular cancer in the UK, and rates have increased steadily over the last 20 years. It most commonly affects men between the ages of 15 to 45 and is statistically the most common cancer in men aged between 25 to 49 in the UK. Around 40% of men diagnosed will be under the age of 35. If found early, there is nearly 100% chance of cure, and 98% of men diagnosed with any stage testicular cancer will be alive 10 years after treatment. But just over 60 men will die each year. The testicles produce sperm and testosterone, the male sex hormone, and are located outside of the body in the scrotum. This is because sperm develop best at a temperature several degrees cooler than normal internal body temperature, at around 94.6 Fahrenheit, that's 35.8 centigrade. It's quite normal for one testicle to be slightly larger than the other, and for one to hang a bit lower than the other. So what are the signs and symptoms and risk factors? In 96% of cases, a small pea-sized lump can be felt. Approximately 80% will be painless. 29% of cases, there will be a report of a dragging sensation. 10% of the time, there will be a recent history of trauma, leading to examination and then discovery of a lump. In rare cases, there will be breast swelling or tenderness caused by hormones, or back pain caused by enlarged lymph nodes. Unlike many cancers, there are few known strong risk factors for testicular cancer, and we cannot currently predict who is likely to get the disease, unlike the link between lung cancer and smoking. Whilst most of these cancers occur in unsuspecting individuals, some risk factors can be traced in the minority of cases. Where there is a history of undescended testicle, this is where the testicle fails to descend into the scrotum. Around 10% of men diagnosed with testicular cancer will have a history of this. In some cases, there's a 50% chance that precancerous cells found inside the testicle, known as carcinoma in situ or CIS, will develop into testicular cancer within 5 years. There is a 4 times greater risk of developing testicular cancer if your father has been affected with it, and a 9 times greater risk if your brother has been affected by testicular cancer. So, what do you do and what are you looking for? Self-examination is the easiest way to identify any potential testicular problems and will only take a few minutes. Get to know your balls, their size, texture, anatomy. It's important that men are aware of what's normal for them. It's normal for one testicle to hang down slightly lower than the other or be slightly bigger. Both should, however, be roughly the same size and smooth to the touch. It's recommended that you should check yourself at least once a month. The best place to check yourself is in a bath or the shower, when your scrotum will be warm and relaxed. The entire surface of both testes should be felt carefully. Roll each testicle between the thumb and forefinger to check the surface is free of lumps. Do not squeeze. They should be almost the same size and weight. Encourage your partner to have a go. as he or she may be more likely to identify a problem in the future and get you to do something about it. There may be something wrong if you find a lump, one ball is bigger than the other, or there is swelling. Nick, can you share the second poll, please? So, do you perform regular self-examination currently? If you'd like to put your answer yes or no. Right, so we're a 50-50. Some of you do, some of you don't. Well, let's hope after the end of this, then that will increase to more, that you will do it more regularly. Thank you. So, any questions so far?
Lovely, thanks, Mary. I'll just have a look. Okay, so we've had some couple of questions. So a question around ethnicity. Is ethnicity a risk factor? I don't know, Sharon, is that something you might want to answer?
Yep, I can do that. So at the moment, it's known that Caucasian men have a higher risk of testicle cancer than men from other ethnic groups, unlike prostate cancer, which is more common in men of direct African and African Caribbean descent. And although research has been undertaken to try and find out why the risk is greater for these men, they still don't know why for sure. So it's just an ongoing research. I hope that answers that.
Yeah, lovely, thank you. So we haven't got any more questions in just at the moment. However, one of the questions that we do get asked when we deliver this session residentially is around what people can do to keep their testicles healthy. Is that a question perhaps, Mary, you might want to answer?
Yeah. Your testicles produce 90% of the male hormone testosterone. But mainly to keep them all healthy, it's keeping fit, avoiding too much fatty food, sugar and caffeine, that'll help. A diet that's rich in A, B and E vitamins, would be very good. So that's things like eggs, avocado, banana, chicken, salmon, beans, cheeses. Zinc is another thing to remember. Hopefully that answers the question.
Sharon, I'm going to hand over to you. You're going to take us through the next part of the webinar. So thank you.
Right, hello there. So not all lumps are cancerous, which is why it's important to visit your GP. So what else could a lump be? These conditions may have similar symptoms to testicular cancer and they may cause you worry. It's what to look out for. So one, an epididymoorchitis. This is where it's inflammation of the epididymis and or the testes, and it's usually due to an infection. It's common in young males around 15 to 30 years. It can occur as a result of a urinary tract infection, a UTI, or a STD, a sexual transmitted disease. The testes can swell rapidly and can be painful, and it usually would require strong antibiotics to treat this. And a hydrocele. The testes are surrounded by a protective tissue sac, which produces a lubricating fluid to allow the testicles to move freely. So any excess fluid usually drains into the veins in the scrotum. But however, if this drainage route has been affected by infection or trauma, the fluid may accumulate and is called a hydrocele. A hydrocele will often feel like a small fluid-filled balloon, and they may cause chronic ache or discomfort. It can often be surgically repaired, and if it becomes too problematic or too big. But it is usually treated depending on whether its bothersome symptoms are present. So a varicose. This is a collection of dilated veins in the scrotum. It often affects ages 15 to 25 years in one or both testes. The affected veins can feel like a bag of worms. It's usually not painful, but it may cause a dragging sensation. This can affect around 15% of the male population. And then we have epididymal cysts. These are usually small fluid-filled cysts which may contain semen. They are usually about the size of a pea, but they can be larger. They usually develop in adults around the age of 40, and they may take many years to form. They are smooth and spherical and tend to be found in the head of the epididymis. They are not cancerous, but they can be surgically removed if they become too big or painful. So you may also experience some pain, but don't worry, it may not be cancer. There are several factors which can be involved, which include in stress. And the wearing of underwear that is too tight, as well as sexual arousal with an erection but without ejaculation, is also known as blue balls. Or physical activity can sometimes cause strain injuries in the lower back and the groin, which may cause nerve pain and which may be felt as pain in the testicles. Pain from blue balls will usually go after a few hours, while chronic sports damage may need further input from a GP or a physiotherapist. But check yourself as we described earlier and go to see your GP if concerned. So what will happen when you visit your GP? They will likely take blood samples. Some testicular cancers produce chemicals which are released into the bloodstream called tumour markers. These may also be repeated after surgery, 48 to 96 hours, but where there have been abnormal beforehand. You then may be referred for scans. A CT scan will check for any potential sign that cancer has spread to other areas of the body, i.e. the lungs or the lymph glands. An ultrasound scan will help in accurately diagnosing testicular cancer. If testicular cancer is suspected, a referral to a specialist urologist is made. If there is a strong suspicion testicular cancer is present, then the decision is made to surgically remove the affected testicle. This decision is not taken lightly, but it is in your best interest. You would not want to wait around and see what happens. And surgery is usually the only time that a definite cancer diagnosis can be verified or ruled out. So what would this surgery involve? The surgery is called an orchidectomy. The surgical removal of a testicle is usually performed very quickly after a suspected diagnosis of testicular cancer. It is a simple procedure taking around a half hour, normally as a day case procedure, and is under general anaesthetic. A small incision is made in the groin area on the affected side, and the testicle is removed from above. The scrotum is not cut. A prosthetic testicle can be inserted at the same time, or at a later date if you are unsure at the time that you want one. Men may also be offered the possibility of sperm storage. Sexual activity can resume after 2 weeks as long as it's not uncomfortable. Post-surgery physical effects should be minimal, with the ability to have an erection unaffected. However, the psychological stress of diagnosis and surgery may well affect your sexual activity. And what happens next? You should receive an appointment within a few weeks to be followed up by an oncologist. The results of your surgery will be discussed along with the need for any further treatment. About 5% with testicular cancer may also have precancerous cells in the other testicle. If this is suspected, a biopsy may be taken at the same time as the orchidectomy. So we are nearing the end of the webinar. I wanted to end with some final advice. What should men do? You should perform testicle self-examination on a regular basis, at least monthly. If you do find any abnormalities, do not worry. Just make an appointment to see your GP. They will understand any embarrassment you may have, but they cannot help you if they don't know about it. If you would like any more information, there are some useful websites here. We will leave this slide up if you wanted to make a note of any of them.
Lovely, thank you, Sharon.
Okay, thanks.
So thanks for listening today, everybody. We have got an opportunity now just to answer any more questions, and thanks, those websites have also been linked into the chat. If anybody missed those as well, you can get them from the chat as well. So one of our attendees has asked if we could just repeat the vitamins and the best foods, please, Mary. I think that was one of the questions that you answered from earlier. Is that okay?
Yeah, no problem. I can go into a bit more detail.
Yeah.
The vitamins are A, B, E, and zinc. You will find those in asparagus, eggs, avocado, bananas, citrus fruits, spinach, tomatoes, and red peppers. Almonds and nuts are a good source of natural fatty acids, which are good for hormone production. And foods such as brown rice, chicken, salmon, beans, and cheeses, they are all good sources of zinc, which testosterone is dependent on. So those are the vitamins and things that you need to make sure that you're including in your diet, but also keep fit and avoid too much fatty fried food, sugar and caffeine to keep your testosterone healthy.
Sharon, I just wondered, how soon would people be referred for treatment after they've been to visit the GP? If they went to the GP with any symptoms, how soon would people be referred for treatment?
Okay, right. So generally, your GP would arrange for you to see a specialist if you have any symptoms that could be due to testicular cancer. And then depending on what your symptoms are and other factors, it could be an urgent referral. Okay. So there are guidelines set out for GPs to help them decide who needs a referral. Some of the UK nations have targets around how quickly you'll be seen. In England at the moment, an urgent referral means that you should see a specialist within 2 weeks. Okay. Scotland, Wales, and in general Northern Ireland don't have this 2-week time frame to see a specialist, but wherever you live, you are seen as quickly as possible. And then if you are concerned, you can always ask your GP when you're likely to get an appointment. And if you feel that your GP is not concerned enough about your symptoms, or you think they should be more concerned, and then you can just ask your GP to talk it through with you and why they're making that decision. And then you might be able to decide together whether you should see a specialist. Lovely. I hope that answers that for you.
Yeah, that's really helpful. Thank you. And I guess the other thing it would be good to cover is, people might worry about the risks of testicular cancer returning. Mary, is that something you could answer? Yeah.
Unfortunately, there is a risk it can return, but it depends what stage it was at when you were diagnosed and what treatment you've had. So once you've completed your treatment, you will then need regular tests to check that everything's still okay, or if things have returned.
Okay.
These can include a physical examination and blood tests that checks for tumour markers, chest x-ray, CT scan. It depends on the extent of the cancer and what the treatment was, is what tests they will do. But these tests will be more frequent in the first year or two, but you might follow-up appointments may last up to 5 years, and in some cases they might just want to keep an eye on you for 10 years or longer. Just depends how it was.
Lovely, thank you. I know that's I know that does worry people, that the risk is there. There's a question just come in, just asking if there is a greater risk if you've had a vasectomy.
Hi. As far as I'm aware, Sharon speaking, as far as we're aware, there isn't, it's not listed as a greater risk. But
I'd agree.
Yeah, but as far as we're aware, and but if you are concerned, you could, visit the websites we've put up to get further information. But as far as we're aware, there isn't a greater risk. that's been recognised.
Lovely, thank you. But I'm guessing if somebody was in that situation, having had a vasectomy and they found a lump or found any abnormalities, you know, we can't stress enough, you know, whatever the situation, whatever your history, please do go and see your GP.
Definitely.
Yep.
Yeah.
Lovely. Any other questions? No. Okay. We hope that you found that really useful today. We really appreciate you joining us. The session has been recorded, as we said at the start, so if it will be available on our website at some point. So if you did want to revisit it, please do so. And obviously, if you wanted to share it with any family members, any of your colleagues, then again, please do share that with them as well. If you would like any more information, obviously you can visit the websites that we've shared, and those have been shared in the chat, like I said earlier, and you can also call our helpline, and if you did have any enquiries, then those enquiries would be directed to one of our nurses, so please do contact us on our helpline. Lovely. So thanks very much everybody today. We hope you have a lovely afternoon. Take care and stay safe, everyone. Bye for now.
Bye.
Bye. Thanks for listening.